Hi, I'm Dr. Jonathan Klar, and I'm a board-certified chiropractic neurologist. This discussion today is going to be about laser therapy, specifically what we call Class 4 high-power laser therapy. This is a device that we use in our office with great success with a myriad of conditions, ranging from carpal tunnel syndrome, peripheral neuropathy, to wound healing, and just chronic, good old-fashioned arthritis and bursitis and degeneration. So laser is really an acronym, as you can see here, for light amplification by stimulated emission of radiation. This would be an example of what our laser therapy actually looks like. You can see we have the clinician treating a patient. She's wearing glasses. The beam is emitted out from this probe right here. This is the actual laser device here in the background. And this is a patient that's obviously being treated for an elbow tendonitis issue. So a lot of your itises this does very well with, and we'll talk about how it affects those tissues here in a minute. But this is just an example of what the actual device looks like. So there's different types of lasers that are used. Obviously we have surgical lasers. These are the ones that are going to be used to cut and kind of get through tissues for surgery. This is what they use in place of a scalpel, the more pinpoint precision for that type of laser. The things we use are what we call a therapeutic laser, and again, this is an example of a clinician using it on a knee. We see a lot of chronic knee problems too, utilizing laser therapy. In fact, some of the ones we usually see are the individuals that are, they need a knee replacement, but they can't have it done for a year or two, so what do they do in the meantime? This is one of those things we're able to bridge the gap. And then following that knee replacement, that knee surgery, we're able to use this to decrease the pain and inflammation faster and decrease the scar tissue formation. But anyways, this is used for a stimulation of cell function. This is what the laser does in our office, the Class 4 laser. It's not a thermal effect, although you do feel heat with this, but it's not going to give you the same kind of heat as obviously a surgical repair laser. So people that are using high power laser therapy, specifically our brand called Avicenna laser, pain management specialists, there's orthopedists using it, neurologists, again, physical medicine, rehabilitation, chiropractic physicians, family physicians, podiatrists, foot doctors. A lot of your sports teams now have laser in their rehab centers. Major League Baseball, National Basketball, professional football, college teams, medical colleges, VA hospitals. Even veterinarians are using this on different animals for rehab. And clinically, I've used this on a lot of my patients here, and obviously at home I've got some animals at home that we treat for laser when they have maybe a wound or some kind of injury that needs attended to. So a lot of different people using laser therapy right now. What this does as far as the wound healing effects of laser therapy, if it's just for a wound, it promotes faster wound healing and regeneration. It significantly increases what's called fibroblasts and collagen production, which are things that are essential for the tissue repair that's been done, the damage that's been done. It improves vascular activity. Basically, we'll be able to get more blood flow to the area, increase capillary production, and it's going to make that wound heal faster. And then it also leads to greater tensile strength. And the things that are laid down as far as the connective tissue, it's much stronger now, including the skin, tendon, ligaments, and the connective tissue fascia as well. So this is also going to help us with our scar tissue reduction, which is very important as well, because less scar tissue, we have better movement in there. So that's a big deal post-surgery or with a wound as well. Here's an example of a patient that had a wound in the bottom of the foot, the bottom of the toe rather. You can see prior to the laser, and this is a month and a half later, and you can see that there's a big difference as far as the healing goes here. This is a clinical patient we saw. This is actually a farmer that came into our office after one of his cattle had run him over. This is the inside of his thigh. And as you can see on the left here, this was a pretty large wound that was open, and he had tried traditional methods prior to coming in to see us, salves, antibiotics, different things like that. And if you look underneath here is a very large, what we would call a hematoma, just basically a blood-filled tumor-like projection here from all the inflammation and blood pooling in the area. We treated him with laser therapy. The time difference between this picture and this picture, again, is a month and a half. And he actually had 3 treatments of laser. And after the very second treatment, it was the first or second treatment, I can't remember which he told me, but he said that basically just fluid started oozing out of the area. because basically it's increasing the blood flow to the area, and just things started draining and started healing right away for him. So again, he had this wound 2 months prior to coming in our office that wasn't healing, and through laser therapy, this is what we were able to obtain. And we've got multiple pictures of clients and patients in our office that with wounds that we've done very well with pre and post. So pretty neat stuff, pretty great technology, so to speak. So there's anti-inflammatory effects of laser therapy as well. So it's an anti-edemic effect. It causes vasodilation and activation of lymphatic drainage system. So again, we're increasing blood flow to the area, and we're able to help drain some of this lymph and fluid that's in there. That's going to help block pain or help basically decrease inflammation. The analgesic or pain blocking effect comes from that increased endorphin release or neurotransmitter release. This anti-inflammatory because less edema is there. So when there's less edema, there's less swelling, obviously less pulling on the nociceptive tissues or the pain receptors in there. And again, suppression of nociceptors, which is basically just a fancy word that means pain receptors. So we're able to stimulate to block what we call a type 3 nociceptor, which is a pain fiber, through this laser therapy. Also, again, what we see in here a lot with carpal tunnel and peripheral neuropathy is improved nerve function. We're literally able to increase the nerve cell reconnections is what we're doing here on a cellular level. Trigger point resolution. A lot of people have chronic trigger points in their areas, and the neck and shoulders is a chronic thing we see in here with the laser, so we're able to use it for that. In addition to a device we call non-surgical spinal decompression, which is something that opens those areas of the spine up. We've been very successful in treating those kind of cases. There's different other practitioners that are still using this stuff and helping or benefiting from Avicenna Class 4 laser therapy. So just kind of a summary of the laser therapy biological effects: accelerated tissue repair and cell growth, faster wound healing, decreased scar tissue formation. It's going to help be anti-inflammatory. And again, this isn't an anti-inflammatory that's going to damage your liver or cause liver toxicity buildups if you're worried about chronic NSAID usage or chronic medication use. Anti-pain, it's analgesic. Improved vascular activity, again, increasing the blood flow to the area, which thereby helps us improve the metabolic activity of it on a cellular level and improve that nerve function and immunoregulation as well. So again, trigger points we already discussed at the very bottom here. These are the conditions that we typically see in our office, and we mentioned some of these already, is peripheral neuropathy or neuropathy, which is basically nerve pain is what this is. Carpal tunnel syndrome, we've done very well helping people avoid carpal tunnel surgery and entrapments with laser therapy. Atypical facial pain responds to this as well. Rotator cuff injuries can do very well with this as well. Classic spinal stenosis does very well with laser therapy, and again, including spinal decompression with that has been a 1-2 punch for stenosis and really helped our patients do very well with that. Pinched nerves, general overall osteoarthritis, degenerative arthritis does very well. Wound repair, again, the knee pain we already talked about earlier, and after you have a surgery, getting back quicker, post-surgery recovery. So we've done very well with this new technology. There's a big difference between the type of lasers that are out there now, and it can be very confusing for some individuals. But a Class 3A, has a power of basically 1 to 5 milliwatts. So the laser pointing I'm using right here and pointing at the screen, this would be a Class 3A laser. Class 3B is oftentimes called the cold laser therapy. So it's a little bit stronger than obviously the laser pointer, but still not near to what a Class 4 is. And the Class 4 lasers that are above 500 milliwatts of power. So that's what we have in here. We actually have both a Class 3 and a Class 4, but the Class 4 seems to do much more penetration. As you can see, there's much more power involved with a Class 4 laser. And particularly we use the 7.5 watt is what our laser is. This just gives you an example. This is going to be a side picture. This is the face and neck and the cranial area right here. This would be using a typical Class 3 cold laser. And you can see the penetration from that is not very good. But once you're able to use a Class 4 laser, basically a lot more penetration, deeper into the tissue, just better bang for buck. You're able to get further into the tissue to stimulate more of those effects that we've already talked about as far as the healing and blocking of the pain receptors and the nociceptors as well. Different things that are used nowadays. This is just kind of comparing and contrasting the laser therapy versus all these other modalities that are out there. and what the laser therapy does with nerve repair, bone regeneration, we've seen that as well, help the individual with that, cartilage repair, soft tissue repair, increased strength of the tendon, penetration into large joint structures, to the bony injury site, through large muscle groups, electrical muscle stim, ultrasound, hot packs, cold therapy, massage, diathermy, TENS, microcurrent. None of that stuff does that over here, folks. But the therapeutic class 4 laser, that's what it does. And that's oftentimes the difference between getting chronic patients better. So for more information, again, you're on our website already, or if you have the video, either way, harrisonburglaserrelief.com. Or you can call our office at 442-8555. Thank you so much for your time.